I would like to see people having more time to see these costs coming, at least, so they could better plan. Like if and I don't even, this is me just talking off the top of my head, but it'd be nice if insurance companies could release their estimates 2 years in advance, saying, all right, in 2 years, this is what the plan's going to cost. That way you can know what's coming. That might be excessive too. I don't know. Kevin, what do you think about that?
Yeah, I mean, I think just the way our current healthcare market works, that it is pretty much impossible because they do reprice these risks every single year, right? So like you can really only know, like you said, maybe 2 months in advance of open enrollment period if there is enough information out there for you to even process that. And the thing is, with all the laws changing or not changing or sort of changing, it's tough for insurance companies to actually properly anticipate who will buy their insurance, right? And that's kind of in a way how they price these premiums to begin with. So it's a very complex business. Whether it should be this complex, I think is a different story. I still, man, if we have a public option, this is just, me being kind of old right now. But if we had a public option back in 2010, which would make at least a public version of a health insurance option available for people, there would be more transparency, I think. There will be more data because it's the government, like the best healthcare data that we can find. It just, for anyone who's curious about healthcare, you still can only find it based on Medicare data. And there's a reason why that's true, because Medicare is, a federal government run program, and it's more consistent, it's more stable, and they're also more willing to share this data out for people because they're not in it for the profit.
Right.
But the same set of data for a private insurance company, that is part of their competitive advantage. So they're very kind of like, closed closeted, or like very kind of angsty about letting people know what is going on with their risk modeling, right? So that's the other part that's really about business, not so much about just getting people healthcare.